Welcome! Today, we are going to learn about myocardial infarction, or also known as heart attack. Every year, around 7 million people die from heart attacks around the world, and cardiovascular disease, which include heart attacks and other issues such as strokes, is the leading cause of death. So how does a heart attack happen? The heart, like all the muscles, requires oxygen, which it often lacks during a heart attack. On the inner walls of our coronary arteries, which is a channel that delivers oxygenated blood to the heart, fatty deposits called plaques are formed. As we become older, these plaques thicken, harden, and become inflamed. Plaques can eventually restrict the movement of liquid. The heart muscle's blood supply is cut off, and the oxygen-starved cells began to die within minutes. A myocardial infarction has occurred. How do you know that someone is having a heart attack? The most common symptom of heart attack is chest pain. It is caused by the oxygen-deprived heart muscles, and patients describe chest pain as crushing or vice-like. It can radiate to left arm, jaw, back, or abdomen. But it's not always as sudden and dramatic as it is in the movies. Some people experience nausea or shortness of breath. Symptoms may be less prominent in women and elderly. For them, weakness and tiredness may be the main signals. And surprisingly, in many people, especially those with diabetes, which affects the nerves that carry pain, a heart attack may be silent. And what to do during a heart attack? If you think that someone might be having a heart attack, the most important thing to do is to respond quickly. If you have access to emergency medical services, call them. They are the fastest way to get to hospital. And taking aspirin, which thins the blood, and nitroglycerin, which opens up the artery, can keep the heart attack from getting worse. So what happens in the emergency department? In the emergency room, doctors can diagnose a heart attack. They commonly use an electrocardiogram to measure the heart's electrical activity and a blood test to assess heart muscle damage. The patient is then taken to an high-tech cardiac suite where tests are done to locate the blockages. Cardiologists can reopen the blocked artery by inflating it with a balloon in a procedure called angioplasty. Sometimes, they also insert a metal or polymer stent that will hold the artery open. More extensive blockages might require coronary artery bypass surgery. Using a piece of vein or artery from another part of the body, heart surgeons can reroute blood flow around the blockage. These procedures re-establish circulation to the cardiac muscle, restoring heart function. Treatments for myocardial infarction are advancing, but prevention is still vital. Genetic factors and lifestyle factors affect the risk. And the good news is that you can change your lifestyle. Exercise, a healthy diet, and weight loss all lower the risk of having a heart attack whether you've had one before or not. Doctors recommend exercising a few times a week doing both aerobic activity and strength training. So what are the foods to eat? Lots of fiber from vegetables, chicken and fish instead of red meat, whole grains and nuts like walnuts and almonds all seem to be beneficial. A good diet and exercise plan can also keep your weight in a healthy range, which lower your risk of having a heart attack. And of course, medications can also help to prevent heart attacks. Doctors often prescribe low-dose aspirin, for example, particularly for patients who've already had a heart attack and for those who are known to be at high risk. And drugs can help manage risk factors like high blood pressure, cholesterol, and diabetes, so it will help or make the heart attack less likely too. Heart attacks may be common, but they don't have to be inevitable. A healthy diet, avoiding tobacco use, staying fit, and enjoying plenty of sleep and a lot of laughter all go a long way in making sure your body's most important muscle function. That would be all. Thank you for listening.